What excites you about the future of healthcare?
I think for me, some exciting things are that we're learning a lot more about health in general, and the amount of systematic reviews and meta-analyses coming out is very exciting to me to learn some more general truths about health. But also, there's this parallel work of personalized care coming out where we learn how to work with the person in front of us in a way that's going to most effectively and efficiently help their own health come about. So those kind of two parallel paths are very exciting to me. So I tend to read systematic reviews and meta-analyses and case reports. I don't read as much in the middle, but that's what I find to be really helpful in actually bringing about positive change for the people I work with.
Yep, fantastic. I appreciate that. What is one thing medical professionals can start doing today to improve the quality of healthcare?
I think if they can focus on their own health, that will actually do a lot to improve the quality of care for a few reasons. So, um, as I observe a lot of healthcare professionals, many of them don't look particularly healthy to me. So, and myself included, I have had many health consequences related to the ways I was conducting my work in my life. So, if they can improve their health, like really, really improve it, focusing on those core tenets of exercise, nutrition, sleep, stress reduction, um, reducing use of alcohol, things like that. I bet their concentration will be better. They'll have fewer errors. They'll have more energy. They'll be more present for their patients. And they'll also develop some more empathy for their patients because they're asking their patients to become healthier, but they may not be doing it themselves. So, both in figuring out what it really takes to become healthy, so they can help advise their patients or understand their patients better, but also in becoming healthier, they'll become better professionals.
Okay, um, let me just ask a quick follow up on that. Okay, when it comes to stress reduction, sometimes I feel like a lot of the stress is systemic in nature,
Mm-hmm.
and it's because of the environment in which they are working. Do you have any suggestions for how to reduce stress when when some of the stress is almost seems like it's inherent to the system?
Yeah, that's a great question and a very practical one, which I love. So, one basic stressor that I found working in a hospital was I wasn't getting exposed to daylight. So, just not even like all the other stuff in healthcare we can talk about as stressors, but my circadian rhythms were off, and I'm working day shifts. I'm not working night shifts or rotating shifts like many providers. So some of it was just forcing myself to walk outside for lunch. Or even if I had rushed my lunch, just to walk outside for 30 seconds and come back in. So there are things like that that are just little pockets of relief in a day to improve or reduce stress. Some other things that I like to do, I monitor my own stress and other people's stress via heart rate variability on some smartwatches. And then I can learn and they can learn what is actually stressing their body and what isn't, because it can be different for each of us. So I found for me that um, the stresses of being paged all day in acute care were a lot for my body, and they aren't for everyone. And so having a different pace of work was helpful for me. Or I found that if I have alcohol at night to unwind after a hard day, my recovery is delayed significantly. So a lot of us might turn to a glass of wine or a drink thinking it'll help us unwind, but at the physiological level, it's only inflaming us more. So that was a way to change my own behavior when I couldn't change the broader system.
Got it. Well, it's interesting. I was just thinking about this. I know that one of the hospitals in our area has food truck Fridays, okay, where every Friday they're bringing in a food truck. And in some ways, it's good because it gives a change of diet and a change of pace but that your circadian rhythm, it gets you outside and it gets you in the sunshine for a little bit. And that may even be a way to address that systemic need that in in a very creative way, not just saying you have to go outside but giving people an incentive to get outside and enjoy it. What a great idea.